There are obviously many forms of contact that carers can have with patients, and we're particularly keen to make sure that, given that some of our services are national services, so people come great distances to receive their care and treatment within Rampton, we have to make sure that people have got access via the telephone, that there's a fairly easy way of accessing the patient on a face-to-face basis and having visits to the hospital. There are processes that we have to go through from a security point of view to make sure that the right people come into the hospital, and they involve an approval process that the multidisciplinary team will go through. It's a fairly straightforward process.
We're very keen that people keep in contact with all their links that they've had previously, and maybe people that they've lost touch with, and that can be family members, that can be friends, that can be people classed as carers, or people that don't want to be classed as carers. We want people to have as much of a link with their previous community as possible, because the hope is that people will ultimately go there in the future. And also, it's really key to somebody's care that they have those continuous conversations with people that know them best. So there's lots of ways that people can keep in touch. They will include telephone contact, so each patient has a contact list of people that they can keep in touch with. We do have quite strong rules around that, which we have to have as part of the high secure regulations and the way the hospital runs, but we are very keen that the social workers work with the patient to get a list of all the people they want to keep in contact with. The patients can also do the old-fashioned writing letters and keeping in contact in that way, but also the hospital can have an email conversation with people on patients' behalf, although patients don't have access to email and the internet themselves. Families and friends can visit patients, and the visits primarily take place on the ward, which is really good because it means people get to experience where that person is living. There is also a carers champion on each of the wards, and their key responsibility is to link in with carers and make sure that their experience is as good as it can be, and that they have all the information that they require about what to do when they're on the ward, how they keep in touch with people, if they've got a concern or a question or a complaint or anything else, that they can go to that person and talk to them about it. In terms of how much information carers can have, that can be tricky because the patient themselves has a say in that, and if a patient doesn't want to see their relatives or doesn't want information shared, we are limited in what we can say. So that is something that's really important, that carers have that conversation and get an understanding of that from the social worker and from the nursing staff, because it can be quite distressing when they want to know how their relative is and the relative doesn't want them to know. Families and friends can actually buy products for their relatives within the shop, or they can send in presents that can be delivered to the wards directly.
They can spend £10 per patient per carer per week. The list, they can access it from the visitors centre, from main reception and from snacks. So they make their selection, they pay over the telephone or in person at snacks. That order is then transferred down to the patient shop, and the goods are collated, and we make those deliveries to the wards within 3 working days.
We do really value the carer's experience of the person that we're looking after, because they've known them a lot longer and know a lot more about them. So we do generally want them to tell us as much as we want to be able to inform them. So we want it to be a two-way process. We also know that historically it's quite a distressing and stressful place to come to, and we appreciate that it can be very difficult for carers coming into an environment like this, and also seeing a relative in an environment like this. So we are keen for them to say if support's needed and if they're struggling, then we can help with that.